So this workshop is purposely for all the civil servants within all the ministries and MDAs in the states. And we are going to take 5 good days, taking different groups each day. And that was why we are here today. The contribution of the state government is 6.5 of the equivalent 3.5 basic salary. So the civil servants are supposed to contribute 3.5 of their basic salary, while the government will actually give a counterpart margin the contribution of the civil servant to subsidize the health care for them. Those that are benefiting from the scheme actually is a whole family. The major enrollee, which is actually we call the principal enrollee, who is actually the civil servant, then his spouse or her spouse, then also 4 children. These are the maximum people that we can take based on the arrangement between the 3.5 and then the 6.5%, making 10% equivalent of the basic minimum wage. However, we also have an additional enrollee, that is, we call it an additional dependents. But those additional dependents are not going to be subsidized by the state government. So as such, the principal enrollee has to actually pay for the additional dependent. But those, the first 6 family members are going to get their health care free. This is actually all kind of illness, especially the one that is actually the one that is very, very essential to us looking at our environment. However, there are some exclusions, like maybe cases of transplant, cases of maybe prosthesis or plastic surgeries. So this high caliber intervention, those are things that we may not be able to actually pay for. But any other illness that you can think of, the basic ones that they are available in our environment and communities, those ones are going to be captured very well, adequately. Yes, there is actually that rights and privileges for all the enrollees. And one is that we are not going to force a enrollee to choose a facility. It is we just make sure that we map out the facility. We look at their facility based on the confidence and based on our criteria, whether it fulfills that criteria. And after that facility is being accredited based on that certain criteria, what we do is just to make it available for all the civil servants to choose out of the many facilities that are available that is most convenient to them. And if peradventure, if they find out that those facilities are not offering the services as they so wish, they also have the right to change their facilities to a better one. So that's actually the arrangement. So we are like trying to favor the clients or the enrollees in this particular way.
Thank you.
We have a whole department dedicated for that, so I'm pretty sure that they will get the quality services. And it's not like we are going to be sitting in our offices. We'll be going around monitoring all the activities so that to ensure that the scheme works.
Thank you so much.
Thank you very much.
My call to them is to in twofold actually. One, they should embrace this policy because it is for their own good, for their health and their families. Where you go and expend money from your pocket to access health services, this cannot give you adequate health that is desired by the family. So to avoid out-of-pocket expenditure, government introduced this policy, and this is for the good of everybody. So that is one. Number two, this workshop that Borno State Contributory Healthcare Management Agency is organizing is for them to understand what the policy is all about and with the benefits that are abound in the policies. So I implore them to be attending this sensitization workshop and listen attentively to the presentations that have been made.